Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
But it's an interesting article in the Washington Post about every 46 minutes a child is treated in the emergency room because of injuries from furniture having falling on them, which is a surprise to me. But those of you who have grandchildren and great-grandchildren and children, have you had any problems with furniture falling on children? That's new
No,
to you, huh?
can't say that I have.
No.
Yeah.
I had problems with them falling on the furniture,
Falling off the
falling on the furniture, bouncing off of the furniture, Furniture takes more abuse from the children than the furniture, the furniture on them.
Yeah, they use the bed as a trampoline.
Well, they said about more than 500,000 youths had to go to the ER because of furniture falling on them. Just part of the accidents that happened. Yeah. Of course, at our age, accidents happen all the time, and falls are probably the commonest, one of the commonest causes of serious accidents and deaths in our age group. Falls. So, and I know many of us have had falls over the last couple of years, right?
Yes.
Yeah. Had many falls running after buses and trains. But I was fortunate, didn't hurt much more than my head once, but most of the other falls were uneventful. But that's the biggest enemy of those who are over 60 is accidents. We've talked about that many times. How exercise and weight building up the muscles that fade away is one of the best protections, as well as exercises that keep you balanced.
What are some good balance exercises?
All right.
What are some good balance exercises?
I got standing on one foot, alternating that, and I think that's one of the better ones. But I think for the most part, muscle strengthening exercises are good, but for balance, standing on one leg at a time and exercising is one of them. Any other things?
Yeah,
Any other?
I've been doing yoga for a couple of years, and that's one of the exercises that we do, balance on one leg and do that for about 30 seconds.
Yeah. Yeah. I think yoga is considered one of the better exercises to do for those of us who are over 60 and need balance as well as muscle strength. You want to start, John?
All righty.
Before we start, Dr. Callender, I wanted to say you did a magnificent job singing at the funeral last week.
How you know?
I heard it, and
really?
I also taped it. And at the
You
end
never
of
know.
yeah,
Want to hear?
You never know who's listening. Huh?
right. And Carol listened to it as well. And at the end of today's session, I might play a little bit of that clip.
Very good.
Well, it was nice to sing for my surgical father, who he was giving all his life, and even in his death, he's giving as well. So it was a great opportunity.
Very good.
Well, thank you. I thought of Darrell as I read this article, and they talk about simple diet change. It, it wasn't really so simple, but anyway, they called it simple. But it actually reminded me of much of the things that Dow was talking about in terms of our eating habits, and it just emphasized again what recent articles have stated, that plant diets are healthier, and avoiding processed foods is very desirable. And this is what they emphasize. And when everybody is saying the same thing, must be something to it, huh? Yeah. That's interesting. You see how they prohibit things, sweets and artificially sweetened beverages, and they don't have it, but I know they prohibit ice cream. And then eating all animal products. Yeah, right. That's it's the vegans that actually don't, as Darrell is, don't do seafood, eggs, or dairy. But anyway, this is one of the articles that talks about the fact that whole food diets is, they call it simple, but I don't know how simple it is. But anyway, you almost have to be wealthy to be able to do it, to find all the things they're talking about. And then this is an interesting study that they left, and they found that those people who didn't have any of those processed foods and were vegans for the most part had did much better. I think virtually all the studies so far demonstrate that plant-based diets associated with the lowest mortality rates. Any comment about that?
Yeah, I just like to say that it's all true.
Yeah. I thought you wrote the article, as a matter of fact.
Well, I could have.
Well, actually, you write it every Thursday. Every Thursday morning. This is an interesting article that kind of takes a different way of saying that a lot of the stuff that people talk about, this food will kill you, this food will save you. This article says that it may be much ado about nothing, although it talks about the fact that one hot dog takes 27 minutes off of your life. And there's no telling how many minutes you take off if you eat as many hot dogs as those people who go into those contests do. But it's interesting, because the conclusion they come to is that there are many good things you can eat, and but to say that one particular meat or one particular meal will take how many minutes or hours off of your life is problematic, because there's so many other ways that you can recover.
And I love a good hot dog.
Dr. Callender, I saw a documentary on TV about how the hot dog was made.
Yeah,
Guys, you all would be surprised.
be
What they
horrified is the term.
horrified, yeah. What they put in a
Really?
hot dog, you would never eat it again if you knew
Oh, wow.
what they put on it.
Mhm.
And the
Yeah,
same thing with bologna.
Okay.
Yeah. Mhm.
yeah. I haven't heard much about bologna recently.
Me either.
People still eat bologna?
I don't.
I don't.
But the last paragraph of that last article,
Yeah, it says
it
it's much
just
ado about
says
nothing.
this whole thing is stupid.
That's what it says.
So you have to read to the very end. to
Right.
realize this is a crazy article because to point out one single food that's going to kill you.
Mhm.
Well,
Yeah.
well, that's their opinion, and it's interesting to hear different points of view on it. That's their opinion was that it's much ado about nothing. But anyway,
Yeah, and this whole article, there's no statistics or any proof that this is research. It's just an article, just to waste your time. There's no scientific data to base this on.
well, actually there is, but the data is mixed. So it's an interesting article that says that sometimes we get carried away with some things and say that one food will kill us and another one won't. And this article, as you say, takes another perspective. And that is that we sometimes overdo it, per se. If we're going to say that one hot dog takes off 27 minutes of your life, that presumes that you're not doing anything else that's healthy. But anyway,
Yeah, the other thing, Dr. Callender, is that to Carol's point, how can they possibly calculate the minutes on your life? I don't think they can do that.
that's the point he was making. That's the point the article is making. That's all. That's really it says studies on single foods impact on life length. That's what he's saying.
Yeah, 27 minutes. What's the difference between 26 minutes?
Yeah, and I think that's the essence of this article.
I have somebody else's testimony. And what is not my testimony, but this past Monday, Labor Day, I had a party of 20 people over, and I had it catered, and it was all vegan food, 100%. And I didn't tell anybody it was vegan food. And don't you know these people tore that food up?
Mm.
Yeah.
Daryl, you should have told them because vegan food does cause, if you're not used, body's not used to it, it gets sort of gaseous.
Well, not necessarily. Yeah, I know that, and that's the nice thing about taking folks to some vegan restaurants and they're not used to it, and you see that the trip home is kind of, that stuff. You kind of laugh at them because you don't know if they can make it to the bathroom in time. But okay, like I didn't put soy in there because soy will do that to folks. And so the diet that the menu that I planned out was intestinal friendly, and so it didn't cause surprises. It was just all a delight for the tastes, and like I say, the people ate that food like it was going out of style.
Yeah.
Well, I can testify for you, Daryl, because when I was in Chicago and we had a taste of Chicago, and I was eating a gyro, and you told me it was vegan, but I didn't really realize it was vegan. And I wanted another one. And I was scared to tell you that we were really eating real meat because I couldn't believe it was actually vegan because it was so delicious. So you can fool people because you fooled me.
I appreciate being able to fool my sister.
This is another article on exercise intensity, and I think it's important to appreciate that there are different levels of exercise intensity, but I think the most important aspect of it is that you should do exercise and 150 minutes at least, and this makes a difference between the quality of life you live and the length of life you live. And I think the bottom line is anything that gets your heart beating faster and breathing heavier is good for you. Whether it's a walk or a bike ride or whatever. And I think that physical activity and aerobic fitness are good for you. Just like the vegan diet is good for you, exercise is good for you. The absence of exercise is lethal as the red meat that you eat. So.
I had a question, Dr. Callender. We're doing a lot of sitting in the pandemic, sitting at the desk, at the computer in the office or whatever. And I've noticed that sometimes my feet maybe even go numb, or, is that a symptom of, poor circulation, or,
Yes, it is. It is. It is poor circulation. And there are many articles that suggest after half an hour to 30 minutes to 60 minutes of sitting, you need to get up and walk around, because they say sitting is the new nicotine. Cigarettes are bad for you, and sitting is not good for you either. And so after you sit for 30 minutes to an hour, you need to get up and walk around. You can also do pedal exercises while you're sitting, because that gets the circulation going.
Is that neuropathy?
Is what neuropathy?
When your feet, when you have cold feet or your feet go numb?
It's not neuropathy. It's a poor circulation that affects the nerves. So it's a circulation problem. As you know, if you decrease this, if you stop the circulation, the nerves die. And so that means the circulation is not good.
What is neuropathy?
Neuropathy is simple, situation in which the nerves are damaged. So it can be caused by a number of different things. Interestingly enough, with when you have poor circulation or poor blood supply, that causes the nerves to die. And so, an early sign of that is the numbness that you're talking about, which means the circulation to the nerves is not good. It's an article on why allergies seem worse this fall. It's interesting. You'd think that spending more time indoors would decrease it, but that's not the case. So have any of you noticed that you're having as many symptoms of allergies, even though you're staying inside more?
A lot of sneezing going on over here sometimes.
Yeah, and I was surprised. I thought that you'd have less, but it's interesting how your body works and how the immunoglobulin E, which is the body's response to allergens.
Also noticed that I never had any allergic reactions at all ever until I was about 50. When I turned 50, all of a sudden I was sensitive to grass pollen and stuff like that. And my brother was extremely allergic to seafood and shellfish. Now, not
Really?
seafood, specifically that, but
And he wasn't allergic before, huh?
no. So it's age related, I think, sometimes.
I have no idea. That's because the general feeling is that as you get older, your immune system weakens. But that's interesting, your observation. I don't know the answer to that. Because many people who have asthma, for example, as they get older, sometimes it goes away or they have less symptoms. And some people, and then of course you have the other person who gets an allergy and actually dies from it. But in general, the expectation is as you get older, your immune system gets less active rather than more active as you have identified. And I don't know the answer to why that is.
Dr. Callender, I've heard that saline is not good for you. Saline nasal spray.
Oh, okay. Well, they talk about that as being as a good thing for you. I don't know. I've never used it, so I don't know why saline nasal spray would be bad for you. Saline, of course, is salt, so
Box of chocolate.
so sodium and
It was good yesterday.
You still need to bring the research for that because, yeah, generally they say that a saline nasal solution, like a neti pot rinse, is very helpful and it's preventative for allergic reactions.
yeah.
Well, good morning. This is Chris.
Hey, Chris.
What's going on?
Long
Since we're
time no
talking
see.
about yes, yes. Since we're talking about allergic reactions to certain things, as a child, you know, mom and dad, they did all the fish and everything, especially on Fridays and stuff. And I did not have an issue with it until I got older. I want to say when I went in the military is when my reaction to seafood and all nuts had changed because before everything was fine. And don't know what happened at that point, that 18, 19-year-old mark. And now it's just progressively getting worse. Like when dad used to fry fish here, he would fry it in the garage. And when I would come over just to chill with them and stuff and sit in the garage with them, I'm not doing anything, but just sitting there and talking to him, my eyes would swell and also close. And it would be very difficult for me to breathe.
Wow.
And even with like making, because I like to cook, so doing some salmon or something like that for my mom and the kids. And when I put it on the grill, I have to wear my mechanics gloves and stuff, wash them before I touch the fish. And
Really?
back in October of last year, salmon juice from the gloves that I was wearing had gotten into my eye and closed my eyes shut for a couple of days. So I had to go to patient first to get that looked at. And then a few years ago at Kayla's birthday party.
You're talking about allergies, and this is the weirdest thing. We were at a birthday celebration about a year or so ago. Now, Chris has been saying that since he's been in the military, I'm allergic to fish, I'm allergic to nuts. And I said, you know, this is crazy. All these years, it never bothered him, and I've never seen an indication of it. At the birthday celebration, there was a chicken dish with nuts in it. Of course, he didn't like the place. I'm not eating anything. And he started eating off my plate. And he said, is nuts in this? I said, sure. I've never seen anything like it. He jumped up, he ran around, and we were in a shopping center. So he ran to a store and got Benadryl, came back drinking it. I gotta go. Okay. Dave and I put him in the car because my daughter-in-law was with her daughter who had a bunch of kids there. And he couldn't stand the car ride. I mean, hurry. And again, I'm thinking it's some kind of a joke, but by the time we got there, he was sweating, everything was swelling, and you have to sign in. So finally, in seeing his reaction, I said, he ate nuts, he's allergic. They came out quickly and got him. And as he was going back, he was dressing. He was just that hot. He was swelling. But I'm wondering how. All the years I knew him, he wasn't allergic to anything. How does something like that change, Dr. Callender?
That's a good question. I'll have to get our immunologist to give us an answer to that. I have no idea. That's an interesting observation. So,
My
yeah.
option is that if you're vegan, you don't have to worry about shellfish and fish allergies. And if you avoid hybrid nut, you don't have to worry about the hybrid nut infections. And
He's eating spam right now. Is that vegan?
John Tatum,
Is spam vegan?
on the saline nasal rinses, I just happen to think you got to use non-iodized salt. If you use iodized salt, you will tear your sinuses up.
Mm.
I've never seen somebody allergic to something that makes them jump up and down and run to the mall.
He said
No.
he was itching and swelling. So you
So yeah, what was happening at that point in time, I could tell that my throat was starting to close. So I knew that there was a Wegmans in the shopping center. So before it had gotten to a point where I couldn't breathe, I just ran to the Wegmans and got some Benadryl, and I took it was pills. I took the 4 Benadryl pills and walked back across the street. Or either no, y'all came and picked me up.
That's
And
nice.
then that's when we went to Patient First. Now I do have an EpiPen, but that particular day I didn't have it on me.
Oh, okay.
Yeah.
Repeat
That
after
is,
me. From this day forward, I will be vegan.
EpiPen. Is EpiPen expensive?
no.
Yeah, I've been told that it's extremely expensive, around that $700, $800, and $900 mark for the pens. By me being a veteran, it's free.
Oh,
Free. I don't have to pay for anything. Let me just say that it's not free, but I don't have to pay anything out of pocket. We're paying for it though. We are paying for it, but I don't have to pay anything out of pocket.
okay.
They're less expensive now, but they used to be very, very expensive. My wife has to carry an EpiPen wherever she goes outside, whereas if there are bees or biting insects, because she has the same reaction, throat swells up, lips swell up, eyes close, all that.
Yeah, I was developing rashes on my back. I believe my arms when we had the peanut incident. But with fish, I'm gonna say within 5 or 10 minutes, depending on how much of a contact I had with the fish, my throat would definitely swell up and start to close, and my eyes definitely start to close. You'll see it.
You think the Benadryl saved your life?
I believe it helped. It definitely helped. If I didn't take it, I think we probably would have had to call 911 for them to give me some type of EpiPen solution or something, a shot at the restaurant that we were located. I think the Benadryl probably bought me some time for us to get to Patient First.
Yeah.
But the strange thing, Dr. Callender, is he was never allergic to anything. He swears it was military and how they used to give them shots for like overseas travel and stuff like that. And he said it changed his body chemistry. When he said he was allergic, I didn't believe it, but I saw it that day.
Yeah.
So how does it change?
Dr. Callender, Dolores, I have a question for Chris. Were you able to take the vaccine, or can you take the flu shot?
Through VA, yes. Those at all VA facilities, the COVID-19 shot is available. The vaccine is available. The flu shot is available, and out of pocket directly, no, we don't have to pay for anything. It's free.
No, I was asking because of your allergies. Were you able to actually take the shot?
Sorry about that. Yes.
Okay, because I have a daughter, and we found out at 6 years old, it took us that long to find out she's allergic to all shellfish. But when she can't take the flu shot, but they gave her the vaccine, but she had to go to the hospital to take it. And she had to stay almost 2 hours because they had to monitor her
For observation.
because of her allergy.
No. The last time I received a flu shot was 2003. And my reaction to that flu shot, as far as my allergies are concerned, I didn't have any issues.
Okay, thank you.
I have a friend, career military, and he said the thing that Chris said, that the shots he got changed his body chemistry and caused quite a few illnesses, long-term chronic illnesses that he still has.
Okay, this article talks about the warning signs of a silent heart attack. We've talked about before, but you can, and one of the things is that silent heart attacks are commonest in diabetics, by the way, but they also occur in other people. And often you find out about it after they've had the heart attack, because you do a special study and you find that the EKG or whatever shows that there's been blockage. But often shortness of breath, weakness and fatigue and sweating can occur without pain, and dizziness and pain in the back of the arms. Sometimes those are the only signs that you've had a heart attack. And as mentioned, there's some people who have no signs at all, and they only find out they had a heart attack by getting special tests.
Dr. Callender, someone once told me a sign they had a massive heart attack, but the sign was a stomach ache. Have you ever heard of that?
Yes, because it depends what you call a stomach ache, because some people think the stomach is right in the chest, and so they call indigestion, and that is often misdiagnosed. And so if you have any chest pain or upper abdominal pain, you think about a heart attack until proven otherwise. Indigestion is, to me, heart attack until proven otherwise. Now, this article doesn't talk about it, but also the presentations in women are different as well. So women and diabetics are more likely to have the silent attacks. And as you see, the other people who also have it, people who have high cholesterol also, lack of exercise, prior heart attack, family history of heart disease as well.
Yes, 1, 2.
And as it says here, some people, after having a EKG, will find out that they've had a heart attack. That's the only evidence they know about. And then, of course, if you have your heart rhythm changes, you could have had a silent heart attack as well.
Dr. Callender, on an EKG or MRI, what do they actually see in those tests that indicate that you may have had a heart attack?
Well, they see the T waves are changed, and the T waves may be like a U, or they can be peak T waves, but they indicate that circulation to the heart is not good, because that's what, and then they go in and do the other blood test that they put dye in your vessels to find out. But the EKG will show a change in the T wave that suggests that your heart is not circulating well. There's a PQRSTU that they look for with the EKG. And this talks about the indigestion that makes people think it's GI, but it's not actually, it's a heart, because the heart is close to the bottom of the chest. And it may mimic indigestion. Well, this is an article that talks about the climate change and how all of that is killing us, so to speak. It's interesting, all of the hurricanes and everything that happens is, they believe, is related to climate change as a consequence of us poisoning the protective environment that the coverage was there before, but where all of the gas emissions are eliminating the protection as a consequence. There's the thought that this is why we have higher temperatures, and this is why we have more hurricanes and tornadoes and other things. Flooding, all of that is thought related to the climate changes. And this is one of the things that Trump was against, and what Biden is for. And so it'll be interesting to see. This is what the guy who lost the presidency from Tennessee has been talking about for at least 30 years now. But no one has been listening up until now. This
Look at
is a
It says meat and dairy account for 14.5% of global greenhouse gas emissions. So it's a huge contributor to global warming. All you people still want to keep eating meat.
thank you, though.
You're welcome.
This is an article that just talks about a virus outbreak that is India. This, of course, is much more deadly than COVID, but not as infectious. So far, it's only in India. Interesting, it's another from bats. Bats don't bring a lot of good things to us, but anyway. Xenozoonosis is a disease that gives disease from animals that pass on to humans.
So this is another one. I'm counting 3 now.
3 what?
3 viruses that can pass from animals to humans.
Oh no, we got so many. There are many of them. There's probably about 100, or maybe 1,000.
AIDS is one of them, right?
Yes.
Yeah. But this is interesting about how to fight the Delta variant of COVID, and why vaccines and masks are so important. And there have been a number of articles recently attesting to the importance of masks. There it talks about how the Delta variant is like gorilla glue. And the viral loads are 1,000 times higher than the ordinary COVID, much more infectious. That's why the unvaccinated are more likely to get sick. While it's much more infectious, it's not any more lethal though. Although it's much more infectious, but it's interesting how the mortality rate is. We've had We've had now, what, 4 million deaths and about 200 million infections. Young people are more likely to get it. And that's why great concern about children not being vaccinated. It is true that the vaccines work. It's just that still people have breakthrough infections, and that's scary. And that's why there's a lot of talk about the booster. And when you think about it, the flu shot we take every year is a consequence of a need to get our immune systems revved up against the different types of flu viruses that present themselves. The one thing the vaccine does is decreases the likelihood of hospitalization and death. 8-fold reduction in hospitalization, 25-fold reduction in death. So it points out the fact that being vaccinated is one thing, being masked and vaccinated is another. And especially when there's a lot of the Delta virus going around. And so, of course, what's next, of course, is to remember to get the flu vaccine also, because one vaccine against COVID does not protect against the flu, and vice versa. And as we said last week, you can get both shots at the same time now. So when you get your flu shots, if you needed a booster, you could get your booster shot at the same time.
Doctor, you're recommending not to get them at the same time?
No, you can get it at the same time.
But I thought you said you should wait a couple of weeks or something in between.
No, I said that I wouldn't get the flu vaccine early. That's what I said.
Okay.
I would get both of them later. In other words, I wouldn't get a flu shot in September. I'd get a flu shot in October because of expecting at my age, my immunity might be lower. And so I'd get the shot closer to the time that the flu is likely to occur, which is in November and December.
Okay.
But you can get both shots at the same time if you want to. It's safe to do that. Okay. Now the question is, why does everybody who's vaccinated not wearing masks? Or I think that's one of the things that we see. We see people outdoors not wearing masks, but indoors it's wisest to wear masks. And then, some of the churches opening and having singers with masks and without masks. So as you think about going back to church, it's important to recognize that when you're inside, you need to be masked. And this is an article that points out that in the years to come, in 22, and it's likely we'll need boosters for flu shot as well, boosters for COVID. Time will tell. We don't know for sure, but early evidence suggests that as the antibodies wane, and there's evidence that after 6 to 8 months, antibody levels wane in some people. And that's why Fauci and many others are suggesting that a booster shot may become important.
Dr. Callender, what is the difference between getting a booster flu shot as opposed to getting a double dose of the flu shot?
The double dose is needed for people who our age is over 65 because the immune system is not as strong. And so that's what the double dose is about. Now, your question was, how does that relate to
a booster shot for the flu?
Oh, that it is a booster shot. That's what those shots are, actually. They are booster shots. Every year you get a flu shot. In many ways, it's a booster shot, but it's a shot that prepares you for the particular virus that is causing the flu this year. In terms of the booster COVID shot, although the timetable for that is not certain, that is a shot that is going to boost your immune system so it will knock out the Delta variant. The question is, if you didn't have a Delta variant, would you need a booster shot? We don't know the answer to that, but since we have the Delta variant, it sounds likely that many people will need a shot for. But the data is not complete yet, so it may well be October before they start the booster shots, if at all. They have to do more antibody tests on the rest of the people to find out if they're necessary.
Dr. Callender, I know that, and John is one of them who have already received their booster shots. Based on what you just said, are they still doing experimental studies on the booster shots, or?
Well, the booster shot that John got is different from the booster shot that people who have normal immune systems.
Okay.
John is taking immunosuppression, so it's obligatory for him because we already know they've done all the research on transplant patients, and they know that their immune system is deficient.
Okay.
And therefore they must have a booster shot.
Okay.
That's in contradistinction to people who have normal immune systems. If you have a normal immune system, that the data is not clear on that, but for the transplant patients, it's clear that you should get a third shot.
Is that also true for some cancer patients?
If you're on immunotherapy, yes.
Okay. Thank you.
Yes. And anybody who's been on immunotherapy and has any questions, you just get a shot. You just let them know that you've had treatment for cancer, that you fall into that category. A lot of talk about boosters, not a lot of data on the normal immune patient, which is different from a 50 or 40-year-old person who has a normal immune system.
We read an article where they indicated you can wait 6 months, but now it's back to 8 months again.
We don't know. I mean, the data is not complete, so probably wait another couple of weeks and we'll know. Okay. Talking about for the people who have normal immune systems, there's a lot of confusion because all of the data's in on, some of the data's in on the Pfizer, so much of it is not in on Moderna, and a lot of it is not in on the Johnson. So there's a lot of information that we still don't have yet. We have, it seems as though much of the data on Pfizer's but not on many of the other vaccines. And what these companies have to do, they have to bring their data to FDA. FDA has to evaluate it and then make a decision. In the meantime, we cannot say absolutely if you have a normal immune system, that you need to have a booster shot.
Dr. Callender, people over 65, when your immune system starts going down, the data is that they will need a booster. Is that correct?
The data suggests that the only question is when, whether it's 6 months or 8 months or whatever. And that's where the controversy is. At what point would you need a booster shot? Or will you need a booster shot? All of the data is not in yet, so it appears as though those people who are over 80 have been protected, and most of the trouble is occurring in those people between 50 and 80. But I think we just have to be patient and wait until we have all the data. We don't have all the data yet. So those who have normal immune systems just have to wait until all the data is. And then we talked about 6 to 8 months, and it'll be the same vaccine, but anyway. The vaccine produces antibodies that target Delta as well. So that seemed to be assured for now, until the next variant comes. Vaccine is our most powerful tool, along with masking. I think the two go together, and I think it's a mistake to think that one without the other is okay. We need both.
John, can you go to that picture? On the right side, that is some mask there. What would you think if a whole lot of people walked around with that thing on?
That's a shield.
I think a shield. A shield is if you're going to be working with COVID positive patients, you should have a mask and a shield. But if you're out in the street, you don't need that.
No, but I'm just imagining a world where everybody has one of those and they're wearing them.
Yeah, well, yeah, well,
They look crazy, yeah.
Interesting.
They would look crazy.
Well, you want to be alive, so that's what matters. Well, so it looks like it'll be 2022 before we really get so-called back to normal. Although most schools are open now. Anywhere in that, Mr. Tatum, in terms of the union and teachers?
A lot of schools are going back already to virtual because of the outbreaks that are happening in the schools already. The elementary kids.
Or nationally.
On the news, they were talking about one particular school district where it wasn't just a classroom, but the whole grade, the 6th grade somewhere, all of the students developed COVID and are out. And they're thinking about closing the school in general.
So we'll see. We'll wait and see.
Yeah, in DC, in the union, what they're fighting on is it safe for teachers to go to the classrooms? So they're treating all the classrooms with antiviral antiseptics and enough CO2 detectors and that kind of stuff because the union does not want the teachers to go in an environment that's not safe. And the issue is children who are, and like I said, elementary school children who are not vaccinated could possibly spread the virus.
Right, right. Well, you still have people who resist the vaccine and masks. Yeah. And this is a group of first responders who refuse to take the vaccine. And it's clear that the unvaccinated are the ones who are more likely to die from the Delta variant.
Okay, we have a guest who has a phone number ending with 7588. Would that person speak up?
Hello,
Who is that?
your big sister.
Oh, I didn't even recognize your phone number. That's my bad. Joyce Brown is on the line. Dr. Callender.
Hi, Joyce. Yeah.
Hello, I'm listening, and I've got to go. Today's Thursday, Dr. Callender. You know it's hair day.
Yes, I
Nothing's
know what happens
changed.
on Thursday. I remember.
Yes, you do. But I'm on, and so
Okay.
hello, doctor. I heard that you were going to be on and talking about feet, and I have an appointment with my podiatrist to get some things straight.
Well, let me tell you, he couldn't get on today. So he's going to come next week. You know about the ransomware problem at Howard University, which
Okay,
is
okay.
knocked out. So next Thursday, he'll be able to get on, we hope. That issue at Howard University, it's amazing. They're going all over all the universities. They first got George
Okay.
Washington. But anyway, so yeah.
Okay.
All right. This is a strange situation where there's no evidence that ivermectin works for COVID, but this judge ordered because this patient wanted this drug to be given. This person went to court to get the medication, and the judge approved it, and another judge came behind him and disapproved it. But it was anyway.
Dr. Callender, how did this get started?
Just like the other drug that Trump was using. Somebody said that this drug worked for COVID, and it's not approved. And somebody said it worked, and the word went around, and people started believing it, and so a lot of people have used it. And so that's why this person went to court to force the hospital to give him the treatment. And the judge fulfilled a request, although a later judge reversed it. But anyway, so, you know, it's amazing that you could get somebody to get a judge to give permission for a drug that's not approved by the FDA for this treatment. But that's what happened. Now, this is the worst article. This is probably one of the worst ones I've ever seen since the Tuskegee incident. They
Oh,
they were given this drug that we were just talking about, and they didn't give permission for this, but that's what they gave them. It's an antiparasitic drug that is not used to treat coronavirus, but they gave these prisoners the drug without their permission. So this is a terrible situation. It's a drug that is approved for parasitic infection, but not for COVID. And that's one of the things that can happen. You can have a drug that is FDA approved for one thing, and then people use it for another because they don't let you know that the drug is only approved for this drug, use of this disease. And so that's what happened in this case. It's an FDA approved drug for antiparasitic, but not for coronavirus. So,
Dr. Callender, this is Joy. Is that the horse medicine they're talking about?
yes,
Okay.
that's the horse medicine. Yeah, that's
Okay.
antiparasitic, right?
Okay. Yeah.
And this is, but to think that in this day and age, you have people in the prison, medicine people giving people treatments without recognizing that it's an experiment, because it's experimental to do that. And it's kind of frightening that that would happen in Arkansas.
Dr. Callender, how did these prisons even get the drug to begin with? Why would they have it?
Well, it's FDA approved drug, and if they and if you use it for parasites, then it's approved for parasites. So they could get the drug because it's approved. There's a approval for its use. We call it off-label use, which means it's approved for one thing, and therefore you can get the drug. But then they use it for something else, and that's called off-label use, and that is not permitted. You may do it for one person, but not for everybody in the jail, and that's experimental.
Very scary.
Very scary. This is a kind of frightening article that in Texas, where finally after the students were infected, they decided to require masks because they voted before, they voted not to wear masks. And finally, after all the kids got infected, they decided they would enforce wearing masks. And so across the country, it's just interesting how certain states refuse to wear masks and other states wait until the kids get infected to require masks. And you see here where 2 teachers died from COVID. And so it's dangerous to the teachers.
Hey.
Yeah, that's what the union is afraid of. Teachers going back to work.
Well, but
getting
this
the virus.
But this is a case where they don't have masks. I mean, the minimum is you should have a mask. I mean, goodness. But that's Texas for you.
Yeah, this is the state where
Texas and Florida.
The governor banned the
Right.
mandate for masks.
Right.
And then he got COVID.
Right. And now he's been vaccinated. Well, it's a strange world we live in. Texas and Florida decide they want to do something different.
Speaking of Florida.
Yeah. Well, it's I don't know why you would stop treating unvaccinated patients. I mean, basically, everybody has the right to be vaccinated or not vaccinated. And if you get sick, whether you're vaccinated or not, you should be treated. I think it's unconscionable. You know, when you, now, of course, you have the right, a doctor has the right to treat or not treat a person. But to not treat somebody because they were not vaccinated doesn't seem to be sensible.
Dr. Callender, it seems like he's saying we will do telemedical or like virtual exams or discussions with the unvaccinated.
That's different. That's that to say that you're not going to treat them because they're unvaccinated is another story. To keep your distance if they're unvaccinated is different.
Yeah, he's just saying they can't come into the office.
Office, yeah.
Yeah, and the journalist made it seem as though you're not going to treat them, which is a different story. Because it makes sense for you to say somebody's unvaccinated and untested. And if they're unvaccinated and tested, that's another story.
So, Dr. Callender, I did a performance this past Sunday at a very large indoor concert hall. And everybody had to show their vaccine card and a picture ID to get in. And the people who did not have the card had the option to get tested. They had COVID testing at this place where they can get quick test, which comes back in 2 to 5 minutes. Even though that quick COVID test has a high false positive, false negative track record. But also at the same time, they gave them the PCR test, which comes back in 24 hours. So at that performance, 270 people got the COVID test. And there were like 800 people inside of this place. The majority of them had masks on, which is interesting. I kept my mask on until I was on stage, and just as a point of reference, that's what I do when I go indoors. I keep the mask on unless I'm actually performing.
Yeah, we have our first service, and as a matter of fact, this Saturday, Johnny Mass is at I forgot, in DC, and they're having an indoor performance. But you have to be vaccinated and have proof of vaccination. And if you don't have it, then you get a refund. So it's interesting how people are responding, because it's clear that they're having concerts now. The question is how they're having them. And I think everybody's required to wear masks.
I'm actually going to a football game Sunday at FedEx Field. And right now, and my wife's going too, so we'll be masked up. Even though, most of it's outdoors, we're going to be masked up.
What kind of football game?
The Washington football team at FedEx Field.
Oh, I see.
NFL.
You don't want to call them Redskins?
No. The name is gone. Name is gone. What are the requirements for going to the game?
I did not look that up, because when we bought our tickets, Delta was not really happening then. So I'm going to have to go on and check it.
You can. What made your wife change her mind? Because at the beginning of this virus, she was very apprehensive about everything.
Yeah, after she got her Moderna, she was happy, and she keeps bombing me out. She said, my Moderna is better than your Pfizer. So yeah, she's back to work. She's going back to in schools with elementary kids, masked or double masked. So this is a new age that we're talking about. The photographs on this slide are about 60 photographs of people getting vaccinated all over the world. China, Indonesia, Key Largo, Florida.
What
Dr. Calendar, I have invested in the with the KN45 mask opposed to just the regular mask.
Well, that's the safest mask.
Yeah, so I made an investment.
Yes. Yeah. Well, it's nice to see. What is scary is that most of the world is not vaccinated. Probably less than 10% of the world is vaccinated.
Good morning. This is 7588. I've got to go now, and I will try to be on time next week.
Yeah. Dr. Jeter will be here next week. He wanted to try to call and phone, but I thought it'd be better to wait for him to give us the full treatment next week.
Okay. Well, I'll see you. Bye-bye.
Okay. Good to hear your voice again. Okay. Anybody thinking of traveling to any of these places? What about you, John Buchanan?
I was considering going to the annual summit, the scuba summit, which would be in one of those islands, but I decided to wait. I have a friend that actually works for the CIA. He's quarantined in the Dominican Republic. He was trying to come home, but he got tested positive for COVID, and he had to be quarantined for 10 days. So he couldn't come home to go back to work.
Wow.
They would not allow him in the airport.
Wow.
So, even if you are positive, even if you test negative and you go somewhere and get sick while you're there or get exposed while you're there, they will not let you go to the airport until you test negative.
Mm.
To me,
Wow.
that's scary too.
Yes, it is. It is. Yeah.
I had a buddy that went to the Bahamas early part of August, mid-August, something like that. And he was out for about 2 weeks. And before he had to go to the airport here, his whole family had to get the test done. And then while they were out there in the Bahamas, in order for them to go to the airport, same situation. The family and himself, they had to go get tested before they went to the airport.
Oh, I see.
And they all turned out negative, right?
Oh yeah, most definitely. Yeah.
Well, what is interesting to me is that Disneyland stayed open throughout the whole thing, right?
Yeah.
It's amazing. That is amazing to me.
Well, no, actually, I believe they were closed when things started to get bad, and they opened back up. Was it late 2020, I believe? Early 21?
Yeah, probably early 21.
Yeah.
I had people going to this.
Around here, Six Flags stayed open during the summer. I had a grandson to work there, so Six Flags was open.
Mm-hmm.
Last year?
This past summer, yeah.
Talking
Yeah,
about 2021?
Yeah, the summer
20,
21.
yeah, 2021.
Oh,
Yeah, he
not 2020.
no, he worked there this past summer. Had a
It's like
job
the
there.
summer's over.
Yeah.
Summer's over.
Yeah, yeah.
Actually, they're still open now. Of course, the weekdays they're closed, but on the weekends they're open. And I believe it's going to be like that all the way up until the end of October, which is their little Halloween thing that they normally have, Halloween Fest or something like that.
Mm-hmm.
Fright Fest, that's what it's called.
Yeah, well, it's going to be frightening.
Yes.
Always is. Okay. Let's go to the next scene of those pictures.
Dr. Callender, I have a question about exercise. I know I'm a little late. We talked about exercising early on, but my husband does have a problem exercising. He says his knees are bad. Okay, he has had both his knees done. So I'm wondering, do you know actually how long knee surgery is supposed to last?
You doing joint replacement surgery?
Yeah, knee replacement, yes.
Probably about 20 years.
20 years, okay.
20 years.
Yeah, okay, so you can exercise, John.
Yeah. Well, yeah, my wife had her bilateral joint and knee replacements about close to 15 years ago. Yeah.
He had one done in 2008 and another one done in 2016.
Yeah.
Yeah. Good.
Well, you know, some exercises are in water can help those people who actually have ankle problems. But there's exercise of all kinds. Exercises that involve the knees, the joints, and other parts of the body. So exercise is one way to stay alive.
Dr. Callender, I came across a young woman, I guess in her 30s yesterday, and she was telling me about what she had heard and how many people believed it. And I was sort of astounded, but I guess it goes around there, and I know everybody's heard this. She was saying that people being vaccinated, period, it caused homosexuality, it caused autism and other things. And I kept thinking, where is she hearing this from? And how come these generations are actually believing this? They hear it from their best friend who might be a custodian or something, but they hear these things and they really believe it. Is anybody else come across someone like that? That they think vaccination causes these various illnesses, or that's why they shouldn't get vaccinated, period.
That's a social media. Social media does that big time. They put all that stupid information out there with no medical proof at all, and people just suck it up. And then they pass it to all their friends. And then it goes, that's what they call viral. It goes viral, and it's stupid, unfortunately.
That's very, they have staunch groups, anti-vax groups that spread this information. And it's amazing how many people participate in that. Some people are medical people who are part of those groups as well.
Dr. Callender, some of that came from the Tuskegee Institute experiments, some of that fear.
Well, I don't know. Fear, it's one thing to have fear, it's one thing to have ignorance. It's another thing to spread misinformation. autism has nothing to do with the Tuskegee incident. And some of the things they're talking about have nothing to do with Tuskegee incident. They have to do with people spreading information and some people believing it and other people not believing it. So I wouldn't give it the honor to say it's related to Tuskegee. It's related to spreading misinformation.
How come physicians believe it and they have the knowledge?
Well, very few physicians. 95% of all physicians are vaccinated, but some of the nurses are going with that. But there are, I said 95%, so 5% may go along with it. So.
Well, Dr. Callender, that article we saw about the inmates, if that gets out, then, inmates around the country are going to be refusing to get any shots, not trusting anybody.
Well, I don't know about that. I think that they have the right to get medication that is authorized. And that medication was unauthorized for that particular disease. And to have a prison to do something like that is shades of Tuskegee, because you shouldn't be experimenting. That's an experiment. And you can't experiment on people without their permission. And that is against the law. And that prison system should be penalized. And that's egregious error. Which you're right, it fosters that kind of thinking.
Yeah, but
right. That's why a lot of people were saying no. They're going back to years ago. The Tuskegee incident. This is the exact same thing. What happened to that prison? So we don't want that to get out. We don't want to make that, world news, because again, people will shut down as far as getting vaccinated.
Well, that would only relate to people in prison.
Mm-hmm.
Right.
Yeah.
Yeah, that would spread around to other prisons and cause inmates not to want to get any kind of shots because they don't trust them.
Well, but I think you can find out what kind of shot. You should know what kind of medicine you're getting, but it fosters the belief that they can give you anything they want to, and in Arkansas they did. So that's unfortunate.
Janice, I'm looking and I see Chris is not on now, but I wanted to ask him how he is feeling today about the shot. Has he yet gotten the shot?
Well, he told us he wasn't going to get vaccinated.
Well, he said he wasn't going to get it. It would be great for someone like you to ask him, to encourage him. He's not at work right now. He has a leg injury. And of course, with Metro, they're mandating that all of their employees get vaccinated. He stepped out of the house. He's outside right now.
I was watching his face while we were talking about the craziness. I specifically wanted to ask him because as I said before, I have a grandson here living with me who has not yet taken the shot. And I just wanted to hear his perspective on really why he has not started.
Right, hold tight. I'm gonna go get him. He's in the next room. Yeah, I would like to know how he responds to that. Just a minute.
He made it clear that he wasn't going to get it.
I heard him say that, but maybe if I hear from a younger person and can directly, my grandson is just saying
that's what
he hadn't gotten it so far. That's one of his arguments. I haven't gotten it so far.
Yeah, well, Chris made it clear he wasn't going to get vaccinated. So.
Yeah, he did.
Yeah. So.
Your grandson made it clear too.
Sort of. Yes, I was just asking if there were could you just explain to me or help me understand why you have decided not to get the vaccination?
I don't understand. I found out that I wasn't getting the vaccination.
You told everybody months ago.
That was
Yeah,
months
you
ago.
told us that.
Okay, so I'm asking now today. I'm asking now today.
You made it clear you weren't gonna get
Have you
vaccinated.
changed any? Or
Have I changed any? My decision to get the vaccination has definitely moved slightly closer to getting it, but mentally, I'm just not ready to get it at this point in time. I'm just not. It's just something that, what is it? Now that I have the ability to say no to a vaccination that was forced on us while we were in the military, we had no say so. If we said no, okay, cool, no problem. We'll see you before Knox and you can sit in jail and all this other good stuff. But now I feel like I have that option to say no, and I just want to do it. I do not want to do it right now. I had two buddies that just died mysteriously from liver cancer. Nobody in their family had any ailments of cancer or just issues with their liver, period. And their ailments, aside from the liver cancer, we all share the migraines, the skin discoloration. It's just certain things that all of us has pretty much have dealt with the anthrax vaccination, and it was some other shots that we had taken while we were in the military. And I'm just afraid of a vaccine that just, even though I feel like they may have been working on that vaccine for years. I don't think that vaccine was developed in that 6 or 8 month time, but we are just now hearing about it within the 6 or 8 month time of this virus that is out. I still don't feel comfortable with taking that shot. These are just thoughts and my beliefs.
Okay.
Thank you very much.
Now, I do protect myself when I do go out and go to restaurants, and even I was talking to Mom. I had to go to Boston for a hearing appointment, and I had to go back in December. But when I flew to Boston, I had on the regular mask, and then I also had on this big old face shield. And we got on the airplane that way. While we were up there in Boston, we walked around that way. I definitely protect myself because I understand how bad her immune system can be if she gets in contact with this particular disease or virus. Hello? Are we still there?
Yeah.
Yeah.
Okay.
Well, thank you.
And say again.
And I ask you specifically because my grandson, he's 25, and he just has said he was not going to take it. I have not pushed it as much as probably I should, because he was born with a crisscross heart. I don't know whether that means his heart is sort of upside down in his body. And I heard on one of our sessions about younger people and some of the effects on their heart. So I still want him to get it, but I just wanted to hear a perspective from someone younger as to why they might not. And I think, and he does as well protect himself when he goes out, and we don't mask in the house, but whenever he's out, he's always masked up and everything.
And I believe it's very important to be careful. I don't know why he's hanging over my shoulder right now, because he's not vaccinated and I am. But a good.
When I do go out, like I said, I wear my mask. Being at Metro, they give us these with the hand sanitizers, and they're very strong. I have a whole bunch of bottles of those. So when I go to the gas station, when I open up the door going into the convenience store, 7-Eleven or something like that, as soon as I get back in my car, I take my stuff out, I squirt it in my hand, and wipe it down, wipe the steering wheel down, the handle on the door, the gear shift, wipe all those items down that I know that I touch on a regular basis, but not knowing that I touch it, but I still wipe everything down. Even money, when I have cash money, and even down to the coins. When I go to McDonald's and I pay $2-3 for my 6-piece nuggets, and I give them a $5 bill. When they hand me back my $2, I take that same hand sanitizer and I rub my money down, and then I put it in my my armrest.
And Dr. Callender will say, but that's not being vaccinated. Am I right, Dr. Callender?
He knows that as well.
Yeah.
As he's evolving, maybe by this time next month, he will come in and tell us he's been vaccinated.
I doubt it.
Breathing
His
on
prerogative.
Breathing
I
on
doubt
His
it.
prerogative. So,
Chris, is your
Breathing on
okay.
vaccination?
Chris, I had a question. How do you feel about has your opinion changed since the FDA approved final, it's not the emergency approval now, it's the full approval for the Pfizer?
I still stand on what I just said.
Right.
I'm
Okay.
just ready for it. I'm
Yeah,
not ready
okay.
for it.
Well, we
Now,
can't
at
make-
the end of this month, the beginning of October, I'm due to go to Puerto Rico. I don't know if I'm gonna get that shot. If they say that it's mandatory for me to get that shot before I go, I think I'm just gonna have to cancel that flight down to Puerto Rico.
Well, yes, it is. One of my girlfriends just came back and you have to show proof that you've been vaccinated.
Really? Okay.
To get in-
I guess I'll be going to Ocean City then.
Okay, well, we've gone that route long enough. He's
Yeah.
made up his mind, so
Thank you, Chris.
move on.
Well, I'm not 100% sold. I mean, I'm not 100% stuck on not getting the vaccine. Like I said, I'm leaning towards it, but I'm just not ready yet. That's all.
Okay.
That's
Well,
All right.
well, thank you very much, everybody, and have a good week. And I wanted to ask our group. We have these recordings, and I think some of us should go over those recordings and decide which ones we want to keep and which ones we don't want to keep, because I did submit our app, and one of the things I think we might want to do is to decide which of the recordings we want to keep for archives and which ones we do not want to keep. So keep that in mind, because maybe we'll have a meeting and talk about reviewing all those recordings and decide which ones we will keep and which ones we will let go. It's food for thought. Think about it. Next meeting, we'll talk more about it.